CRIF to make second payout of $3.4 billion to Jamaica. The Caribbean Catastrophe Risk Financing Facility CRIF has announced that it will make a second payout of $3.4 billion, US $21.1 million to the government of Jamaica following the passage of Hurricane Melissa due to the triggering of the government's excess rainfall per metric insurance policy. On October 31, the CRIF had announced that Jamaica would receive a payout of $11.4 billion, US $70.8 million on the country's tropical cyclone policy. The total payouts to Jamaica from the CRIF amounts to Jamaican $14.8 billion so far. On November 3rd, CRIF provided the government with a portion of the tropical cyclone policy payout, US $8 million, to provide immediate access to cash. The remaining US $62.8 million will be paid out by November 13, which CRIF says is in keeping with its key value proportion of making payouts within 14 days of an event. The excess rainfall policy payout will also be made within 14 days following final model verification. Excess rainfall assessments typically take a few days longer than tropical cyclone evaluations due to the complexity of rainfall distribution and localized impacts. Jamaica currently has coverage from CRIF for tropical cyclones, excess rainfall, and earthquakes. CRIF's parametric insurance policy are designed to respond to the intensity of a hazard event, considering the assets exposed and the potential losses based on predefined models. The tropical cyclone policy is based on model losses from wind and storm surge, and the excess rainfall policy is based on the volume and distribution of rainfall. Prior to these two payouts for Hurricane Melissa, Jamaica received three other payouts in previous years on its tropical cyclone and excess rainfall policies from tropical cyclones Beryl, Eta, and Zeta. CRIF's Chief Executive Officer Isaac Anthony plans to visit Jamaica to meet with senior officials to discuss how CRIF can provide further assistance for the country's recovery efforts and how it can support the government in further enhancing its financial protection strategy. Mobay Community College facing long closure. Principal of Mobay Community College, Dr. Darren Henry, has warned that a considerable amount of money will be needed to restore the college's campuses in Montego Bay and from Westmoreland following Hurricane Melissa. My college has been severely displaced and devastated as a result of the hurricane, Henry told reporters. He said MBCC's main campus on Alice Elmore Drive in Montego Bay suffered widespread and multi-layer damage with classrooms, laboratories, administrative spaces, and critical support areas impacted. The registry building, which houses the principal and vice principal's offices, has severe roof failure and water intrusion, stated Henry. The auditorium, which connects 83 classrooms and labs, is significantly damaged, and the lecture theatre also has major roof loss. He said the student service area, air conditioning system, and fiber optic connections are down, while the classrooms blocks A, B, and C sustained significant electrical damage. According to Henry, several classrooms were flooded, particularly on Block C, with signs of sewage contamination requiring professional sanitization before reoccupation. The college field is waterlogged, entrances are blocked by silt, while perimeter fence and drainage system have been destroyed, Henry added. He told reporters that the From campus suffered even more damage. The administrative block lost its roof, 2 classrooms and 2 computer labs were severely damaged, and the staff room and guidance counseling offices also sustained roofing failure, Henry pointed out. Based on the scale and magnitude of the impact that the hurricane has caused on both our campuses, it will take us some time yet for us to get back up and running, Henry added. The MBCC principal says immediate priorities included emergency roofing, structural stabilization, detailed technical assessments, and environmental decontamination. Major cleanup and deep sanitization will be essential, said Henry, who also chairs Nandilo Special School of Special Education in Westmoreland. He said the institution also lost several roofs and will need major repair. For the school system in Western Jamaica to be back up and running, at least in the short to medium term, a considerable amount of resources will have to be expended to get the infrastructure not only at MBCC but throughout the school network as well, Henry noted. He pointed out that many students, the school staff members, have been severely affected by Melissa. On Tuesday, Prime Minister Dr. Andrew Holness, in a statement in Parliament, noted that while assessments are still underway in the education sector, many schools, especially in the western parishes, have been severely damaged or destroyed, and others across the island have also been affected. According to Wholeness, at present, 446 schools serving nearly 1,500 students face major disruption. The situation in Western Jamaica is particularly grave and poses a real risk of significant learning loss. Our children need their classrooms and the structure they provide. Every day out of school is a day of lost opportunity, said Wholeness, as he argued with the nation that they must also be pragmatic. The doors of many schools cannot reopen immediately, so while we move with urgency to repair and rebuild, we must act now to resume learning through innovative and flexible arrangements so that no child is left behind, added Wholeness. The Prime Minister pointed out that after Hurricane Beryl in 2024, the government responded swiftly, aiding by the time of the summer break. This time, we must move even faster, as Hurricane Melissa offers no such reprieve. Our focus will be therefore on three clear priorities: safe reopening with facilities permit, continuity of learning through blended remote and alternative sites where needed, and accelerated reconstruction to return students to permanent classrooms as soon as possible, added Wholeness. Health sector workers hailed as loyal, heroic, committed. Public health staff who turned up for duty despite suffering personal losses because of Hurricane Melissa were on Tuesday hailed as loyal, heroic, and committed. However, officials in the sector are on edge, as a reported 10 to 20% of staff have not been accounted for since Melissa's assault on October 28. They have been diligent and heroic. The workers of healthcare are also victims of the storm. They have been loyal and committed. They still show up for work unless they are marooned in, but they are also traumatized from the experience. They have lost their roof, their possessions, and so on. And so the rest of us are helping to coordinate interventions to give them support while trying to mount a response to the infrastructure and services that are offered by them, Health and Wellness Minister Dr. Christopher Tufton noted. He said a health cluster Hurricane Melissa response meeting with donor agencies and non-governmental organizations at a hotel in St. Andrew. Tufton pointed out that there are nearly 23,000 public health workers in the system, from porters to doctors and nurses across the island. Nicole Dawkins Wright, Director of Emergency Disaster Management and Special Services in the ministry, said while the majority of public health workers are at their posts, there is concern about those who have not surfaced since the storm. If I were to group the main challenges we're having at this time, the main headings they would fall into would be the infrastructure, our workforce. Based on reports so far, we still have some accounting to do for some of our healthcare workers, and for those we have to account for still, which is about 10 to 20% that we haven't completed accounted for, she noted. Hurricane Melissa, which now holds the record as the most intense storm ever to make landfall on Jamaica, packing winds of 185 miles per hour, hits the southwestern section of the island on Tuesday, October 28, near New Hope, Westmoreland. Dawkins Wright said up to Tuesday, 60% of the reconnaissance to scope the damage done has been carried out, told the meeting that a significant amount of health records have been lost. That has its own implications, which we need a solution for. We're still in the evaluation mode, so what the solution will be informed by that, she said, adding that some of the mosque capacity within the parishes are also compromised. And so, what will happen going forward needs to be addressed as well, Dawkins Wright stated. Dr. Bisosa Mackenzie, Chief Medical Officer of Health in Jamaica, social issues are a huge problem for not just health workers, who themselves are challenged in terms of having to cope with their losses and provide care, but ordinary survivors of the storm. During a slide presentation, Dr. Mackenzie showed images she said she captured while driving through hurricane-ravaged areas. That lady sitting down with her head in her hand, we saw a lot of that. People just sitting on the rumble, what to do, everything is lost. So that's a very real situation. A lot of people with no houses just on the road, the chief medical officer stated, noting that traversing along the area that was previously very rich and lush with vegetation is now depressing. Bisosa Mackenzie noted, we have a lot of psychosocial issues that we have to manage. I know that we have the Pan American Health Organization team that is coming to help us set up psychosocial centers within each of our parishes, and I don't think that we can get enough help in terms of psychologists and social workers and those types of paramedic personnel. because we are going to be needing staff centers right across the country with these persons who are able to just listen to persons, offer solutions where there are solutions, and just provide help for them, she told the meeting. To subscribe, like, share, and click the notification bell for daily updates.